So we've actually engaged through our various networks like the Nigerian Red Cross and many other partners across the state, and in collaboration with the State Ministry of Health, the State EPIDs, the Directors of Public Health, to see how we could be able to increase awareness for Lassa fever. It's very important to note that Lassa fever is not a death sentence, and there is also need to destigmatize Lassa fever. The earlier people are aware of what to do. For instance, we always say once you have treated malaria or any type of fever, maybe from a bacterial infection, for 2 days, which is 48 hours, and is not responding, you should really present yourself immediately to the hospital, and also you should raise a high index of suspicion to the healthcare workers for Lassa fever. So it's very important. We know that outbreaks occur and ends in communities. Once communities are involved and able to also carry out community-led interventions, this will greatly help reduce and prevent Lassa fever spread within the communities. So this is one of the key strategies that we've also seen to have worked. When we also deployed National Rapid Response Team to states who were reporting at that time, to 10 states, which we did in this particular outbreak, part of the things they had for their terms of reference was also to engage the communities, of course, engage the various actors in the continuum of care for Lassa fever, of course, even carry out sensitization in mosques, churches, to be able to get the community in a state, whereby they are enlightened to take informed decisions. These are part of the things we've done. And even there was a time as well, we also launched a course. Well, it's still very much available for healthcare workers to be able to do, be able to increase their index of suspicion for Lassa fever. It's a very mobile-friendly course which can be taken at the comforts and at their own pace. And we did this in collaboration with the NTA, CDA, and Resolve to Save Life, and Affinet as well. We've also carried out some form of sustainability plans, especially leveraging on the network of Nigerian Red Cross across 36 states and FCT. And even last year, or the last outbreak season, we also implemented a project, the DREF project, the Disaster Relief Emergency Fund project with the Nigerian Red Cross. And this was done in certain high-burden states in the country. But we know that more effort is needed, especially to be able to reach more people across 30 states and FCT. I mean, even in high-burden areas, you still have issues whereby people are misinformed or disinformed about Lassa fever. Some people think, it's an anger of the gods or it's just a spiritual attack. But actually, I mean, these rats carrying the virus, mastomys rats especially, of course, live within homes based on the poor natures of the buildings, or people that may be farmers who are in the farms, living in shacks with their farms, easily come in contact with this rat. And unfortunately, sometimes you see this, these farmers coming down with diseases, and sometimes, unfortunately, resulting in fatality. So risk communication and community engagement is very much important. It's also important to know that Lassa fever is not a death sentence. We need to destigmatize it, and early reporting and presentation at a healthcare facility saves lives.
All right. You keep saying it's not a death sentence, but we